Good morning students, myself Dr. Ambika Dhiman. So today we will discuss about the classification of poison. As I already told, poison is a substance which can be mechanical, chemical or physiological agent which produces adverse effect to the biological organism. It is called as poison. So its classification is as wise. First is corrosive, second is irritant, third is neurotic, fourth is cardiac, fifth is asphyxiant, and sixth is miscellaneous. So in corrosive poison, you can remember it as MOVA, M-O-V-A. M for mineral acid, it includes the sulfuric acid and nitric acid, etc. Organic acid includes the carbolic acid, which is also called as phenol or oxalic acid. Third one is vegetable acid, and it includes the hydrocyanic acid. And next is alkalis, it includes the caustic soda. Next is irritant poison. It includes the inorganic poison and organic poison. In inorganic poison, it includes the metallic and non-metallic poison. So metallic includes the arsenic, mercury, antimony, etc. And in non-metallic, it comes as a phosphorus, chlorine, iodine, bromine, etc. And in organic poison, it includes the vegetable and animal poison. Vegetable poison includes the castor oil. Animal poison includes the snake or scorpion venom. Next is neurotic poison. Neurotic poison includes the SID, somniferous, inebriant and deliriant. It can be remembered it as SID. Okay. In somniferous, there are opium and its alkaloid can be included. And next is inebriant. Alcohol and anesthesia products or anesthesia drugs are included. And next is deliriant. Deliriant includes the dhatura, belladonna, etc. So before telling you about the classification of poison according to the motive or nature, I wanted to tell you about the suicidal poisoning. So what is suicidal poisoning? Suicidal poisoning is basically an act of intentionally causing one's own death through the poison. So mode of the poisoning is through the ingestion, intravenous or any other mode. So it is common in the people who are suffering from mental disorder, depression, autism, schizophrenia, personality disorder, anxiety or substance abuse. Substance abuse is basically the person who are taking daily the sedative drugs are called as substance abuse. And next is what is suicidal poison means idol of the suicidal poison. So idol of the suicidal poison is basically the poison. It can be easily available, it doesn't have any bad taste, it doesn't cause any pain, it should be available very easily, and it should be highly toxic, tasteless and capable of taking with the food. Why it is called as ideal is because the person who is about to suicide doesn't want to take any pain, and he doesn't want to taste that poison, and it should be highly toxic because the less dose, if it is causing poisoning, then he or she can be able to go to the edge of death. Now we will study about the excretion of the poison. If the poison is not absorbed in the body, it gets excreted through the feces or vomiting. And if it get absorbed, then it almost excreted from the urine. If the poison is volatile in nature, then it get exhaled out through the breathing. And some portion of the poison is also excreted through the bile, saliva or milk. Now we will study about the metabolism of poison in the body. So metabolism is basically it is the absorption excretion of the particular substance. So before absorption of the poison, it exerts its effects in the GI tract, and when it is absorbed, it reaches different part of the body. If we see the cumulative toxicity, it gets accumulated in the organ or tissue. Sometimes it get accumulated on the liver, sometimes it accumulated on the kidney, and later on they leads to renal failure or kidney failure, etc. Liver plays very important role in detoxifying the particular poison or any toxin. Okay, and it is most strongest organ in the body. And PM changes or post-mortem changes are not seen in the chloroform or nitrates or acetic acid. This is most important question which can be occurred in the MCQ also. Now the classification of poison according to the motive or nature. According to this is there are 10 number of classification. First is homicidal. Through the homicidal poisoning, arsenic digitalis are the best example. Next is suicidal poisoning. People used to take opium, barbiturates, organophosphorus compounds, copper sulfate for the suicidal purpose. For accidental sometimes gaseous poisoning may happen, like carbon monoxide, carbon dioxide, and aspirin, etc. And next is abortifacient. For abortifacient, calotropis is very common, and for stupefying agent, dhatura is very common. People used to rob the other person by giving dhatura. And next is agents used to cause bodily injury, like acids and alkali. Okay, this includes the disfigurement of the face, etc. Next is cattle poison. Cattle poison include the Abrus precatorius, that is gunja. Next is malingering. People used to hurt other, or we can say malingering is basically false wound formation, and it is most common in the children who don't want to go to school and just want some awareness towards them. That is why they create the false wound formation by applying semicarpus anacardium on their body, or we can say bhallatak. Okay, next is arrow poison. Arrow poison is basically after it's a preparation of the arrow by Abrus precatorius. Okay, next is aphrodisiac. It includes the cannabis, cocaine, arsenic, opium, etc. Now about the ideal homicidal poison. The ideal homicidal poison should be cheap, easily available, colorless, tasteless, odorless, highly toxic. It should not have residual product. It should not contain any antidote, or we can say there is no universal antidote for that. It should not show any symptoms after death, that is called as post-mortem changes. No post-mortem changes should be there, and capable of mix with the food. That is because the person should not identify that there is something mixing in the food. That is why it is ideal homicide. Now the route of administration. The route of administration of poison are oral. Oral route, it is adopted by the alphos or acids, and inhalation is for the gaseous poison, and per enteral like IM, IV, subcutaneous, intradermal can be administered. And next is natural orifice, say nasal, rectal, or vaginal or urethral orifice. These are the common orifice from where the poison can be transmitted, and it also can be transmitted to the ulcer wound.